Welcome everyone to the Statewide Medicaid Managed Care Managed Medical Assistance Program webinar for Managed Medical Assistance. This presentation will teach you about prescription drug benefits and managed medical assistance in the Statewide Medicaid Managed Care Program. To access today's presentation, please visit the link below, aka.myflorida.com/SMMC, and select the News and Events link under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event and Training Materials to download the slides from today's presentation. You may also view details regarding future SMMC events by selecting the Calendar of Events and Training. Last, choose the files you would like to save. Another note, you may also view files from past events and ACA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenters. We have Arlene Elliott and Pierce Withers, both with the Agency for Healthcare Administration. Due to time constraints, we will not be hosting a chat session at the end of today's webinar, but we ask if you have any questions to please send them to our agency mailbox, that's flmedicaidmanagedcare@aca.myflorida.com. I will now hand you over to Pierce and Arlene.
Good afternoon, everyone. The purpose of today's presentation is to provide a general overview of the prescription drug benefit in the Managed Medical Assistance Program, as well as to offer general policy guidance to Medicaid recipients, patient advocates, and other shareholders in Florida's healthcare community.
Medicaid prescription drug coverage. Medicaid is a joint federal-state program that pays for medical assistance for individuals and families with low incomes and relatively few assets.
Florida provides coverage for outpatient prescription drugs to all categorically eligible individuals and most other enrollees within our Medicaid program.
Statewide Medicaid Managed Care. In 2011, the Florida legislature directed the agency to create the statewide Medicaid Managed Care Program.
The program has two key components, the Managed Medical Assistance MMA program and the Long-Term Care Program. The MMA program includes prescription drug benefits.
This slide shows MMA implementation dates by region. MMA is being implemented on a regional basis. As you can see, regions 2, 3, and 4 went live on May 1st. The rest of the go-live dates are also shown here.
This slide shows the statewide Medicaid Managed Care Program by region. Please note that each region and the counties in that region are displayed on this slide.
What medications will be covered? For at least the first year of operations, all MMA plans must use the Florida Medicaid Preferred Drug List. This means that every Medicaid recipient will have access to the same prescription medications, regardless of which MMA plan they choose. Florida's Medicaid Preferred Drug List is a listing of efficacious, safe, and cost-effective choices for all practitioners in all outpatient settings to reference when prescribing for Medicaid recipients.
Coverage and prior authorization. MMA plans must cover all the medications on Medicaid's preferred drug list. Plans may also choose to cover additional medications. Remember that MMA plans' prior authorization criteria cannot be more restrictive than Medicaid's current criteria. Also note that plans can decide not to require prior authorization for a medication.
Medicaid recipients and the Florida PDL. All outpatient prescription drugs currently on the Medicaid-covered drug file must be available on the first date of each region's rollout to ensure continuity of care for all Medicaid recipients.
The agency is encouraging MMA plans to take all steps necessary to provide access to all existing prescription drug medications on day one.
The 60-day continuity of care period. For up to the first 60 days of enrollment in MMA, Medicaid recipients can receive their existing prescription drugs from their current pharmacy. This is called an open pharmacy network, and all MMA plans are required to operate one for the first 60 days in each region. Any prescription drugs with a prior authorization on file must be covered without requiring additional approval from the MMA plan.
Continuity of care continued. For medications dispensed during the 60-day continuity of care period, MMA plans must reimburse pharmacy providers, even those that are not contracted as part of the plan's network, at established open network reimbursement rates.
After the 60-day continuity of care period, Medicaid recipients may be required to change to a pharmacy in their MMA plan's pharmacy provider network.
Here's how you can get ready for the MMA program. First, 1 month before the MMA program starts, ask your pharmacy for a list of your prescriptions for the last 4 months.
Also, if you need to change pharmacies, take your prescription bottles and the list of your last 4 months of prescriptions to your new pharmacy.
And remember, you can continue to receive the same medications for up to 60 days after you are in your new MMA plan. This gives you time to see your doctor if you need to update your prescriptions or if you need to have your new plan approve your medications.
Problems at the pharmacy counter? The agency has created a messaging system to assist pharmacists in filling existing prescriptions even if a Medicaid recipient has enrolled in a new MMA plan but does not have a new ID card when she visits the pharmacy.
The agency systems will send back the enrollee's new MMA plan information, and that will allow the pharmacist to fill the prescription without delay. This information includes the MMA plan enrollee ID number and plan billing information.
Medicaid recipient drug utilization data will be sent to MMA plans. Just prior to MMA implementation in each region, each MMA plan will receive from Medicaid a file of claims information for its new enrollees to assist in meeting continuity of care goals. This includes pharmacy claims for the past year, active prior authorizations for prescription drugs, medical prior authorizations for inpatient care, and medical prior authorizations for home health.
So let's summarize the efforts that the agency is taking to ensure continuity of care for pharmacy benefits. Remember that MMA plans must use the Medicaid preferred drug list for the first year. Also, Medicaid recipients are entitled to receive existing medications from existing providers for the first 60 days after enrollment. This is called an open pharmacy network. Additionally, the agency has developed a pharmacy messaging system that will cross-reference existing Medicaid ID numbers to new plan ID information. And all Medicaid managed medical assistance plans will receive 1 year of pharmacy claims history and active prior authorizations just prior to the go-live date in each region across the state.
If anybody needs to report a complaint about a plan, here is the link to the online form found at the link shown here. Click on the Report a Complaint blue button. If you need assistance completing this form or wish to verbally report your issue, please contact your Medicaid area office. Find contact information for the Medicaid area offices at the link shown here.
There are many additional resources online that can help you become acquainted with the Managed Medical Assistance Program. Remember that questions can be emailed to flmedicaidmanagedcare@aca.myflorida.com. Also, updates about the statewide Medicaid Managed Care Program are posted at www.aca.myflorida.com/SMMC. And remember, upcoming events and news can be found on the News and Events tab. And you can sign up for our mailing list by clicking on the red Program Updates box at the right-hand side of the page. And continue to check our Frequently Asked Questions button as we update Frequently Asked Questions on a regular basis. We're also providing resources for providers. Weekly provider informational calls regarding the rollout of the Managed Medical Assistance Program are being held. Please refer to our SMM page, aca.myflorida.com/SMMC, for dates, times, and call-in instructions. Calls will address specific issues for the following kinds of providers: mental health and substance abuse, dental, therapy, durable medical equipment, home health, physicians, Medipass, pharmacy, hospitals and hospice, and skilled nursing facilities, assisted living facilities, and adult family care homes. You can also follow the Agency for Healthcare Administration on the following social media sites: YouTube, Facebook, Twitter, and SlideShare.
I'd like to remind you to send any questions that you may have to our agency mailbox. That's FL Medicaid Managed Care at aca.myflorida.com. Thank you for participating in today's presentation and have a great day.